Let's start, 43, we start on 43 for the answers.
Yeah, it's 43.
Thank you.
Okay. Good morning, everyone. My name is Shakira Fudge, and I'll be presenting on swine dysentery. Swine dysentery is formerly known as embryonic dysentery, Superlina or Treponema Dysenteriae. What is swine dysentery? It is a severe mucohemorrhagic enteric disease in pigs, and it has important losses due to mortality. It affects pigs during their growth and finishing stages, which are between the ages of 8 to 24 weeks. The etiology. It is caused by Brachyspire Dysenteriae, which is gram-negative anaerobic spirochete that produces strong beta hemolysis on blood agar. And as you can see, I have examples of what the results would be on blood agar with your strong beta hemolysis versus your weak beta hemolysis. Pathogenesis. The Brachyspire proliferates in the large intestines and causes degeneration and inflammation of the superficial mucosa. This leads to hypersecretion of mucus, which then leads to multifocal bleeding on the mucosal surface. So more commonly, a mucoid diarrhea with flecks of blood and mucus develops and progresses to a watery mucohemorrhagic diarrhea. After several days, the feces are brown and contain flecks of fibrin and debris and forms a mucofibrinously exudate. As a result, the diarrhemic pigs are dehydrated, profoundly weak, emaciated, and they may also be anorexic, have soft feces, and have a fever. They can also die acutely. Here's more pictures showing the clinical signs. As you can see, the bloody staining on the perineum and the thin unthriftiness of the pigs during the course of the disease. Transmission. This is extremely contagious and a rapid spread. The transmission is mainly by the fecal-oral route, and asymptomatic carrier pigs are the most important mode of transmission from farm to farm because they shed up to 70 days. It can also be transmitted by fomites in reservoirs such as flies, mice, birds, and dogs. Gross lesions. You will see fibrinous necrotizing hemorrhagic colitis and syphilitis, which is inflammation of the cecum. You may also see mucosa covered by mucus, fibrin, flecks of blood. Mesentery in the large intestinal walls may be edematous and hyperemic. And in chronic cases, you may see a thick fibrino-necrotic pseudomembrane, as seen in the bottom picture. Okay, so in the top picture, you have a chronic case of swine dysentery, which causes a greatly thickened colonic wall, including some mesocolic edema. And then in acute cases, which is depicted in the bottom picture, you would see gross lesions indicating fibrinonecrotic mucosal surface on the colon and cecum with blood-tinged contents as seen here. It's kind of a shiny appearance here. I don't know if does,
yeah.
Yes.
And especially at the bottom.
I'm sorry?
Oh, I just said especially at the bottom, like you can see the spread, the mesentery, how, no, the bottom of the top.
Right.
Yeah.
Okay, yes.
Like,
Okay. Microscopically, there may be abundant spiral-shaped organism colonizing the epithelium. These are the spirochetes. Diagnosis is based on history, which will consist of explosive outbreak of bloody diarrhea in growing finishing pigs. Again, the diarrhea is mucofibrinohemorrhagic, and the gross lesions are confined to the cecum and colon. You can also diagnosis through blood agar, which you will see the strong beta hemolysis, and PCR is used for definitive diagnosis. Differentials. So our differential list consists of spirochetal diarrhea, which is caused by Brachyspirea pilosicoli. In contrast to Brachyspirea hyodysenteriae, this causes weekly beta hemolysis. And then we have proliferative enteritis, which is caused by Lawsonia intracellularis. This will consist of a necrotic thickened ileum. Salmonella, there's two types of Salmonella species that affect pigs, which includes Typhonarium and Cholera cereus. Typhonarium is zoonotic and it causes a yellow watery diarrhea, Bolton ulcers in the colon and cecum, and Cholera cereus causes septicemia with enteritis. Another differential is Trichuria cereus, which is a whipworm. It causes typhlitis, which is again inflammation of the cecum, and bloody diarrhea. Hog cholera, or classic swine fever caused by pestivirus, will cause a turkey egg kidney, as seen here, and splenic infarct. Treatment. The treatment mainly consists of vancomycin and macrolides. You can treat individually or you can treat in large groups, which would be included in the water and feed. Management, you want to isolate infected pigs and do not allow them to mix. You can eradicate the disease by medication, as what I just stated, and it is imperative to empty and clean and disinfect pens. You can depopulate, and rodents can act as a vector of the disease, and it's key importance to control rodent population, and effective vaccines are not available. Summary. So the etiology is Brachyspirea hyodysenteriae, which is gram-negative anaerobic spirochete that produces strong beta hemolysis on blood agar. Again, the history of explosive outbreak bloody diarrhea in growing and finishing pigs. The diarrhea is mucofibrinohemorrhagic. Gross lesions are confined to the cecum and colon. And for definitive diagnosis, PCR is used. You isolate infected pigs and treat with licomycin, virginomycin, and other macrolides. And these are my references. Any questions? Yes, Dr. Gilbert.
In your reading, did you find another bacteria associated with dysentery, another species of Brachyspirea?
No, not other than the Brachyspirea pilosicoli, which causes the weekly beta hemolysis. Other than that, I did not.
There's been some recent articles about Brachyspirea hampsonii, but I don't know how well established that is, but that's like a recent bacterial species that has been causing the same clinical signs for Brachyspirea hyodysenteriae. So you may start hearing about that in the future, hampsonii.
Okay. Thank you for letting me know. Any other questions? All right, I have questions for you guys. You have been called to investigate an outbreak of diarrhea in feeder-growing pigs, which are between 8 and 16 weeks old. Which diarrhea disease most commonly affects this age group? These are old NAPLE questions, by the way.
We start on 43.
Does anyone need any more time? All right. Which of the following is the most appropriate therapy for swine dysentery? Does anyone need any more time? Successful management strategies to limit the production losses due to Brachyspirea hyodysenteriae include which of the following? Sounds good. Okay. All right.
Oh, that's deep. Get rid of them.
All right, is everybody ready? Good morning. My name is Allie Tripp. I'm going to be presenting to you today on shipping fever, or the bovine respiratory disease complex, or BRD for short. Can everybody hear me? Okay. Okay, good. Okay, so what is it? Shipping fever is a multifactorial respiratory disease of cattle. It is the most common and costly respiratory disease, particularly in feedlot cattle. The most important aspect of this disease is a predisposing or inciting stressful event, such as shipping, which is properly named, or weaning. And this predisposes the animals to developing the bacterial infection. And the most common bacterial etiologies involved with shipping fever are Mannheimia hemolytica and Pasteurella multocida. Those are the two most common and the two most important. You also see Histophilus somni and Mycoplasma bovis less commonly. So the bacteria, Mannheimia hemolytica and Pasteurella multocida are considered normal flora of the bovine upper respiratory tract, so they are commensals. Histophilus somni is another opportunistic pathogen that also resides in the nasal passages of cattle. There are viral components of BRD. These can complicate the bacterial infection or come before the bacterial infection and predispose the animal to developing that. The most common viral components of BRD are bovine viral diarrhea virus, or BVDV, which is a pestivirus, infectious bovine rhinotracheitis, which is IBR or red nose, known as bovine herpes virus 1, bovine respiratory syncytial virus, or BRSV, that is a pneumovirus in the paramyxovirus family, and parainfluenza virus type 3, or PI3, which is a paramyxovirus. So clinical presentation, it occurs most commonly in feedlot calves approximately 4 weeks after weaning, because that's a very stressful time for them. They're being taken off of their mother, they're switching to a solid food as opposed to suckling, and they're put into groups, which is just a very, very stressful period. So the clinical signs you'll see early on in the disease process are depression, loss of appetite, and a temperature usually above 104 degrees. And this temperature above 104 is usually an early indicator of BRD. Later in the disease process, you will see coughing, tachypnea, labored breathing, and nasal discharge. And the clinical signs with BRD can vary depending on the bacteria and the viruses that are involved. Gross lesions, most commonly with shipping fever, you will see a fibrinosuppurative bronchopneumonia. usually in the cranioventral aspect of the lungs. You'll also see multiple areas of consolidation in the lungs, also again in the cranioventral aspect. But the fibrinosuppurative bronchopneumonia is most common. Microscopically, you will see necrotic leukocytes, including neutrophils and macrophages, that exhibit a stringing pattern of pale basophilic chromatin, and this is called an oat cell pattern, and that's characteristic. It's obviously not really easy to see here, but it's there, I promise. Diagnosis. Diagnosis of M. hemolytica is usually made based on clinical signs. Response to treatment is also another important way of diagnosing it, and at necropsy. You can also perform a bacterial culture, and for this you would take antemortem samples from tracheal swabs, a transtracheal wash, or bronchoalveolar lavage. Moving to treatment. So early identification of BRD in calves is very, very important in treating this disease. There's two products in particular that have been labeled for the use of treatment of BRD, and those are Exceed, which is a Zoetis product. It's ceftiopur crystalline, and it's effective against Mannheimia hemolytica, Pasteurella impertosa, and Histophilus somni. It has a 13-day meat withdrawal period. And because we're talking primarily about beef cows, about feedlot cattle, the meat withdrawal period is important when you're talking about treatment. The other drug labeled for use is Naxal. It's also Zoetis. It's ceftiopur sodium, and it has a 0 milk withdrawal time and a 4-day meat withdrawal period. And it is also effective against the same pathogens as Exceed. Prevention. The easiest way and the best way to prevent shipping fever is to vaccinate. Vaccinate these calves before they are shipped to the feedlot and as soon as they get to the feedlot in order to prevent it. It's also important to provide proper nutrition prior to weaning and to shipping. So that means not switching these calves to a high energy ration immediately, kind of do it gradually because this will predispose them to developing acidosis, and that can lower their immune system. Also castrating calves prior to shipping, not immediately before, and weaning these calves 2 to 3 weeks before shipping. So basically, the most important way to prevent this, or the easiest way to prevent this, is to reduce the stress on these calves. Metaphylaxis with long-acting antibiotics such as oxytetracycline, tomicin, and tulathromycin on arrival to the feedlot has also been shown to significantly reduce morbidity due to shipping fever. These are my references. Any questions? Yeah.
So you said silmicocin is considered an antibiotic preventative. Is it not considered a treatment for BRD?
Typically not. It's typically used as a metaphylactic treatment. We tend to lean on Exceed and Naxal, those two products that I mentioned, to treat this because of the known withdrawal periods. Tomicin is kind of used in order to minimize or prevent an outbreak of this. Anybody else? Okay, I have some questions for y'all. Number 1. You're presented with a 6-month-old feedlot steer who was recently shipped from a small family operation. The steer has a 2-day history of depression, anorexia, cough, and labored breathing. His vaccination history is unknown. What is the most likely causative agent of the steer's clinical signs? A. Mycoplasma bovis. B. Mannheimia hemolytica. C. Bovine herpes virus 1. Or D. Parainfluenza virus type 3. Everybody good? Number 2. Which of the following management recommendations would most likely help minimize feedlot outbreaks of shipping fever? A, do not wean calves prior to shipping to feedlot. B, vaccinate with a modified live shipping fever vaccine 3 weeks prior to shipping and on arrival to feedlot. C, castrate bull calves on arrival at feedlot. Or D, begin feeding high energy rations immediately, so say immediately, upon arrival at feedlot. This is an old Natalie question. Everybody good? Any more time? Alright, last question. What is the most common histopathologic finding in the lungs of animals affected with M. hemolytica? A, necrotizing bronchiolitis. B, exudative alveolitis. C, fibrinosuppurative bronchopneumonia. Or D, pulmonary edema.